Hello there, I'm Stephen Bunting and I'm a physiotherapist based in the northwest of England. This video is about exercises for carpal tunnel syndrome and is made alongside my other video which explores the condition in more detail. You can check that out here. And I suggest watching that first so you can learn a little bit more about the condition and some of the other treatments that might be worth trying alongside these exercises. Okay, so before we get started, the first thing to say is that carpal tunnel syndrome is a problem with the median nerve, right here in the front of the wrist. And nerves can often be quite sensitive to certain movements, so these exercises should always be done gently and with caution. If your symptoms get a lot worse while doing them, or fail to settle down quickly after you've stopped, then get some further advice from a physio or other healthcare professional. The median nerve travels from the side of the neck and then deep through the shoulder, under the biceps muscle, crosses the front of the elbow and then along the forearm before travelling through the carpal tunnel on its way into the hand. And so any positions of wrist extension, elbow extension and also bending the neck to the opposite side will maximally move the nerve. The exercises that help encourage nerve movement are sometimes called nerve sliding or gliding exercises, and with carpal tunnel syndrome they work on the assumption that regular movement of the nerve within the carpal tunnel can help stimulate healing and recovery of the nerve. The exercises can also be useful after carpal tunnel surgery in order to help avoid scar tissue formation around the nerve and tendons. So the first exercise is just a simple movement of the wrist from flexion to extension to try and get the nerve sliding through the carpal tunnel. For most people this will be fairly easy and can be considered a warm-up type movement. It's best to do this for maybe a minute at a time and then little and often throughout the day. To progress this exercise and to encourage a little bit more nerve movement, you can do what I like to call the spider legs exercise. With your fingertips together and elbows out to the side, you push your palms gently together before then doing the opposite movement with fingers and wrists flexed. Again, this exercise is best done for a minute or so and then repeated every few hours throughout the day. Exercise number 2 starts to involve the elbow and shoulder in order to get a bit more nerve sliding movement. Imagine bouncing a ball on the floor or pushing a helium balloon repeatedly down towards the floor. You can do this with one or both arms depending on whether you have symptoms in both hands. Then try raising your arms a little to involve the shoulders. The movement we're trying to encourage is similar to using a yo-yo, and indeed if you have a yo-yo buried in a drawer somewhere, then blow the dust off it and give it a go. It's a great way to make your exercise a bit more interesting and functional. Other functional movements include doing an imaginary breaststroke swimming movement and will also have a similar effect. Or better still, go and do a few lengths in your local pool. The final exercise adds in neck side bending in order to encourage nerve movement along its entire length. Just make sure you don't have any significant neck problems before trying these, and if you do get neck pain, then get checked out first. This position will cause the greatest amount of nerve movement, and so do this with caution and avoid the temptation to overstretch. You can do this exercise in a variety of different ways according to your abilities and whether you are exercising one or both arms. This movement sometimes gets called a nerve flossing exercise, and you can see why. You can add in neck movement with this one also. Another variation includes stretching out both arms together. So now that you understand the theme of these exercises, you can try different variations to suit your abilities. Median nerve movements are often associated with pushing activities, and so it can be helpful to imagine pushing an object away from you. With all these exercises, please be mindful of symptoms. It's not unusual to cause a mild degree of increased hand tingling while doing some of them, but it should always settle down within a few minutes after you've finished. There's no hard and fast rules about repetition and frequency, just do them little and often throughout the day. If you have a desk job, then try and do the first exercise for maybe 10 or 20 seconds on and off throughout the day. And if you want to treat yourself to an early Christmas present, go and buy a yo-yo. That's it. Thanks for watching, and bye for now.